Welcome, doctors and healthcare providers. Today, we're diving into something that's becoming a game changer for clinics everywhere: our VMAs, and how they're transforming the way we handle scheduling. You might be thinking, is this just another trend, or is there real value here? Well, it's more than just a trend. Strategic move that's helping practices like yours improve patient experience and streamline operations. Let's start by addressing a concern I know many of you have: outsourcing scheduling? That seems risky. What if it leads to communication gaps or a loss of control? Dr. Smith, a family medicine doctor, felt the same way at first. He was hesitant to trust someone outside the practice with something as crucial as scheduling. But as Dr. Joe, a dermatologist, shared, once he partnered with a reliable VMA provider, everything changed. Dr. Joe, how did things shift for you? Well, for starters, we got rid of those endless hold times that frustrate patients. Our VMA team handles scheduling and reminders 7 days a week. They're also fully integrated into our EHR system, so there's no extra work on our part. Dr. Smith, I know you're probably wondering about compliance. What about HIPAA violations? Dr. Joe responds, that's one of the first things I made sure of. Our VMA provider is HIPAA compliant and they signed a business associate agreement. The VMAs are trained in secure communication and documentation practices, so there's no risk there. Now, Dr. Smith asked a key question: what about your staff? Were they on board with the idea? There was some resistance at first, but once the staff saw how much it freed them up to focus on patient care instead of answering phones, they were all in. Now, they appreciate the support, and we've seen better morale in the office. And here results? Dr. Joe reports that his no-show rate has dropped by 40%. Personal follow-ups from the VMAs work wonders. They call and confirm appointments the day before, and if someone cancels, they reschedule quickly, filling that spot right away. Dr. Smith seems intrigued. That's impressive. I might have to look into this more seriously, but make sure the partner you choose understands healthcare and not just call center work. So, what can VMAs actually do on a typical day? A lot more than you might think. They're not just answering calls, they're handling a variety of tasks that can really make a difference for your practice. They book, cancel, and reschedule appointments. They send reminders via phone, text, or email, and even confirm appointments to reduce no-shows. They also help manage insurance and eligibility checks, ensuring your patients are covered before they even walk in the door. And they're constantly updating your EMR, keeping everything up to date and compliant. Some VMAs even assist with billing, collecting payment info and prepping data for your billing team, helping to ensure no claim gets left behind. But there are also some challenges to consider when integrating VMAs into your practice. For one, data privacy and HIPAA compliance are absolutely crucial. You'll want to make sure you're working with a provider that offers HIPAA compliant systems and has signed a business associate agreement. Training for VMAs on secure communication practices is a must. Another challenge is system integration. Not all VMAs will be familiar with your specific practice management or EHR system. To avoid inefficiencies, make sure the vendor you choose specializes in the software you use and ensure a solid training period. What about patient trust? Some patients might be wary of sharing personal information with someone they can't see in person. Make sure patients know they're speaking to trained professionals, and that their information is being handled with care. Adoption by your team can also be a challenge. Some staff may feel threatened or confused about the new workflow. The key here is communication. Make sure everyone understands that VMAs are there to support the team, not replace anyone. Once they realize they can focus more on patient care instead of scheduling, the resistance often fades away. And finally, there are some time zone and communication gaps to consider. If your VMAs work remotely, make sure their shifts align with your peak hours and schedule regular check-ins to keep everything running smoothly. By outsourcing scheduling and administrative tasks to VMAs, you're not just saving time, you're improving the whole patient experience. From reducing no-shows to improving workflow efficiency, VMAs can really enhance your practice when integrated thoughtfully. So, what did we learn today? Efficiency matters. Patient experience matters. With the right VMA provider, you can get all of this without disrupting the heart of your practice. If you're interested in learning more about healthcare outsourcing and how it can benefit your practice, don't forget to like, subscribe, and follow us for more insights. And remember, with healthcare outsourcing services like those provided by Staffingly, you can enhance both your operational efficiency and patient satisfaction. It's all about creating more space for patient care while leaving the administrative tasks to the experts. Thanks for watching, and we'll see you in the next video.